Welcome to The Explainer. We're diving into one of the biggest headaches in healthcare, paperwork. We're going to look at how generative AI is basically stepping into the exam room to try and solve it once and for all. So let's just start with a number, 13 and a half. That's how many hours, on average, a healthcare professional spends wrestling with paperwork. Not every month, every single week. It's a huge, huge burden. And to put that in perspective, that means more than a quarter of a doctor's day is just gone, spent on documentation. Just think about that for a second. That's almost the exact same amount of time they get to spend face-to-face with you, with their patients. You know, this isn't just about being busy. It's so much more than an inconvenience. Every single one of those minutes spent on a keyboard is a minute stolen from patient care. It is a direct line to burnout, and it drains the very energy that should be going toward healing. But what if tech could finally lift some of that weight? Well, this is exactly where generative AI is coming in, and it's offering a completely new way to think about documentation. Now, this didn't just happen overnight. This has been a long time coming. We've seen this slow evolution from really basic transcription software to what we're seeing today, these super sophisticated ambient AI scribes that can listen in on a whole conversation. So, the official name for this whole field is AI Clinical Documentation Integrity, or AI-CDI. So, what does that actually mean? Well, at its core, it's about using AI to check over all the clinical notes to make sure they're supporting great patient care, that the billing is accurate, and that everything is compliant. And AI-CDI isn't just one single thing. It's more like a toolbox. You've got your ambient scribes that just listen in, you have real-time tools that give doctors suggestions as they type, and even autonomous systems that can help with all that complicated medical coding after a visit. Okay, so let's get into the nitty-gritty. How does an AI scribe actually turn a conversation between a doctor and a patient into a perfectly structured medical record? Let's break it down. Right, the whole thing kicks off with the conversation itself. The very first step is using something called automatic speech recognition, or ASR, to just turn all that spoken audio into a raw text transcript. But, just a wall of text isn't very useful. So the next step, and this is absolutely crucial, is called diarization. This is where the AI is smart enough to go through and figure out who said what, labeling every line as either the doctor speaking or the patient. Without this context, the whole thing falls apart. Okay, so once the AI knows who's talking, it can start organizing everything into these standard structured formats. You see a couple of the most common ones here. SOAP notes, which are a staple for medical assessments, and then burp notes, which are specifically designed for behavioral health. But here's the thing. The quality of that note, it totally depends on the instructions, the prompts that we give the AI. You give it a simple prompt, you might get a pretty basic note back. But if you use advanced prompting with super detailed examples and structured data, that's when you get consistently accurate, high-quality results. And wow, the choice of the AI model itself is critical. I mean, just look at this chart. It's showing how 4 big models perform when creating those SOAP notes. That blue line, that's GPT-4. It consistently scores higher on accuracy than its competitors. It's a stark reminder that in this game, not all AI is created equal. The model really, really matters. So this technology is incredibly powerful, no doubt about it. But this is medicine we're talking about, and the stakes couldn't be higher. We have to be really clear-eyed and weigh the incredible promise against some very real perils. On the one hand, the promise is just massive. For a clinic, AI scribes can mean better quality of care, they can help optimize revenue because nothing gets missed, and they create huge efficiency gains for doctors. They can even help stop those frustrating insurance denials by making sure the paperwork is perfect from the get-go. But on the other hand, the dangers are just as serious. Accuracy is everything. These models can make mistakes, they can leave out critical information, or they can even hallucinate. That's when the AI just confidently makes stuff up. And that, of course, opens up a huge can of worms around liability, patient privacy, and even hidden biases in the algorithm. And that brings us to this fundamental truth in medicine. The clinical note is the legal record, period. If it wasn't written down, then in the eyes of the law, it never happened. That's why the accuracy of these AI notes isn't just a feature, it is everything. And this is exactly why, at least for the foreseeable future, human oversight is completely non-negotiable. An AI-generated note is not the final word. It's a first draft. It always, always has to be carefully reviewed, edited, and signed off on by a human professional before it becomes part of the official record. Now, looking ahead, this technology could fundamentally change what a clinical note even is. It could transform it from this static, one-time snapshot into a living, breathing document. So imagine this. Instead of writing a whole new note from scratch every time you see a doctor, the AI just updates the existing record. It would pull in new info from your latest visit, from lab results, and build this continuous, rich story of your health journey over time. But all this efficiency brings up a really fascinating new question. Are we running the risk of creating cognitive debt? If doctors start to rely too heavily on AI to remember and summarize a patient's story, could their own critical thinking and memory skills kind of get out of shape over time? And that really leaves us with one last big, provocative thought to chew on. As AI becomes the one writing the first draft of medicine, are we going to free up our clinicians to be more human, to focus on empathy and connection? Or do we risk losing the subtle, crucial art of clinical reasoning that is so often learned in the simple act of writing it all down yourself?